All right. Well, we have a couple emails from people throughout the week, and one of them said, Dr. Klein, and this would have been
That
from
would have
last
been me.
week,
Yeah. Okay.
yesterday on the radio show, you told someone that a high blood pressure medication can reduce enlarged prostate. Can you tell me what that medicine is?
Very, very good. Okay, this is something that I want people to understand. Okay, and that's that if you're clever about what you do, a side effect or an unintended side effect can become salutary or desirable if you are willful. Okay, now with regards to blood pressure medications, most of them have more side effects than they do normal effects. Yeah, you can lower somebody's blood pressure. Okay, you can do that by exsanguinating them if you had to, side effect being very bad. Okay, but there's a medication called prazosin. Okay, now prazosin has a particularly interesting quality to it in that it will shrink the prostate gland. So, you have blood pressure issues, you need to take a medication. Well, you can take all kinds of choices. You can take the calcium channel blockers. They'll make your ankles swell and make your hydraulics stop working, if you know what I mean.
Ouch.
Or, yeah, that's always good for a few laughs. Yes, dear, I do love you, but, something's not quite right. Or you can take something like prazosin, okay, which is a very, very interesting medication. You take it at night, and all of a sudden you start finding yourself not having to get up to pee quite so frequently. So in my practice, what I do is I start people off very, very lightly with it, because if you don't, they pass out. Okay, you're going to wonder, well, if you're taking it at bedtime, why would you pass out? These are the same individuals that have to get up 3 to 4 times. So what I have them do is this. It's a ritual. You take the medication when you rack out. When it's time to get up to pee, okay, and hopefully the frequency will decrease, you sit by the side of the bed with your feet dangling down and count to 30. Then you stand up and count to 30. And what this does is it allows the blood pressure to equilibrate before you walk to the bathroom. Otherwise, you're going to fall down and break your neck. And no kidding, this will happen. Okay, so prazosin is extraordinarily strong as it pertains to the blood pressure, but it will shrink the prostate. It will make people a whole lot happier. And then guess what? If you don't wake up to pee in the middle of the night, you sleep better and you start feeling better. So prazosin, I think it's a giveaway actually at Publix. It is a freebie. Wow. It is so cheap, I can't tell you.